Good morning.
Good morning.
How are you today?
I am doing fine. Thank you so much for asking. And I hope you're doing well too.
Yes, we are doing the best we can. Um, Thank you for agreeing to chat with me. May I ask you please to tell us your name and share anything you feel comfortable sharing about yourself?
My name is Bilikis Jumoke Akindele. I am first a Nigerian and I moved to the United States in 2012 for a master's degree program in healthcare informatics. I'm part of that group of, I used to be a physician in Nigeria before moving here, and the understanding of the challenges within the healthcare system and the healthcare ecosystem, the opportunities that information technology allows us to have was one of the driving factor for me to decide to make that move to come to the US. I am previously married. I have a daughter. I currently work at GlaxoSmithKline, GSK US, in the US Medical Affairs Group as a director for medical analytics and an insights lead as well. So that's what I do currently.
Absolutely. Why did you decide to give up being a doctor to come to the U.S.? Can you tell us a little bit about Nigeria and how you got from what you were doing there to coming here to do what you're doing now?
I wouldn't say I gave up being a doctor because I always still say that I am a physician. By heart, true and true, that's still what I do. I just, at this journey in my life, at this point in my journey, I am not seeing patients physically. I am not in clinical practice at this point. But everything I do always ties back to the dream that I had as a young child, which is to affect people's lives and the lives of communities in the best of ways, and help to ensure that the accessibility to healthcare facilities and great health outcomes is a good is realizable, it's achievable, and is achieved actually. So those still remain my goal, and in every position that I take, I always do a reflection on whether that opportunity or that job or whatever that role is helps to contribute to that big purpose of actually influencing people's lives and affecting healthcare positively for the population. That always is still at the background. But to your point, in clinical practice in Nigeria, it was fraught with a lot of challenges. I can recall, working through different wards and seeing patients die for reasons that I feel are just not necessary. It's just the very avoidable reasons that these patients die from. It's sometimes as basic as not having their consumables, like there's no methylated spirit in some cases. People have to go through all of these hoops to be able to get their laboratory tests done. The tests are done, sometimes it's difficult to get the results back. It takes hours and days, cuts the epileptic supply of electricity in Nigeria, for instance, definitely affects that a lot. There's also the whole issue around the socioeconomic abilities of the patients the patients I see. A lot of them, they have to pay out of pocket. So definitely financing for healthcare is a very big part of the concerns that I always have. We know what to do as physicians. We know what to do. We know how to go about making these people feel good and be better. But just the challenges within the system, either their own personal situations and sometimes the structural issues within the hospitals, make it difficult for them to come up with those things that they really need to survive whatever health issues they might have. And going through that, seeing that in both adults and children especially, that always breaks my heart a lot, to lose a child's life, just because the parents can afford the medications that the child needs. Those types of things really break my heart a lot. So after going through all of that as both a student in some of my rotations and also as a physician working fully after graduating, I was trying my best to just figure out what other things can I do to help to make the healthcare industry a lot better. I know I've spoken in terms of Nigerian experience, but I know even just by virtue of being here and having studied some of the healthcare system here as well, I know it's fraught with a lot of challenges. And I think one of the ways to help to solve that is a way to make sure that the purpose for which physicians go to school to study medicine, the idea of wanting to save lives, is not lost on us just because of distractions that are around us. So everything that I do again is tied to that big factor of what can we do, either from the inside or from the outside, that can help to lead to greater health outcomes.
Well, thank you for that. Let me ask you, Nigeria doesn't have any government offered health care for its people. Is that not a social issue there?
There's been a lot of, I think it's a matter of the how do I call it, the prioritization. So there's been different moves by the government going far back in time of trying to establish some form of healthcare insurance system. And a little bit of that is available currently, at least to the best that I'm able to keep up since I've left Nigeria for some time. I know that there are certain pieces that I might not be able to represent fully, but I always tie myself back to what's going on in Nigeria, so I can speak a little bit about that. There is the National Health Insurance Scheme, which is supposed to help with affordability of healthcare services, but that program is still not available to majority of Nigerians. And a lot of people still, perhaps maybe, I think the last time I was reading through that was about 5% of people were on that insurance scheme, of the population of Nigeria were on the insurance scheme. And a lot of that is skewed also to people who are gainfully employed either by the government or they, by some other parties in Nigeria. There's also the private insurance, which is mostly available to people who have high-paying jobs and are working with big organizations in Nigeria. So there is some form of insurance support, but I think it's still very lacking in the population that needs them the most, the people who are in the lower socioeconomic strata of the country, which is a lot, unfortunately.
What is the population of Nigeria, and is it what is the racial makeup? In other words, do you have Black Nigerians, white Nigerians, Hispanic, Latino Nigerians? Can you talk about that a little bit?
The majority of Nigerians are there. Nigeria is in West Africa, so pretty much everyone is African. Pretty everyone is, physically Black. But there's variation in Black, as you also perhaps know. There's a different range in the color. To some people, I don't look as Black as some other folks that I've come across as well. So I think physically there is that, but I think the general piece is almost everyone is Black. We do have some expatriates and some other people who have moved from different areas, different continents, that are living in Nigeria as well. So we do have a lot, but majority of people, perhaps over 90% of people living in Nigeria will be Black, considered Black, of the Black race.
Okay. And what's the overall population? How big is Nigeria compared?
Nigeria is over 200 million, I think, in the last count. It's over 200 million people living in Nigeria. There's a wide variation of ethnicity as well. So even within the whole concept of Black as well, you have different tribes, you have different ethnic groups within that section as well. The major groups in Nigeria are Yoruba, Igbo, and Hausa. But we have just a lot of folks. And the language, for instance, we have over 300 different types of languages in Nigeria. But there is the official language in Nigeria as a result of colonization and all of that piece is English, mostly the British English, because we got independence from England.
Wow. And is there a have and a have not communities in Nigeria? So, and if so, is the haves or the have-nots greater?
The have-nots are greater. I think the last time if I can recall very well, the poverty, rate is about maybe almost 70% or thereabouts in Nigeria. When you're looking at the people, you're looking at the affordability of basic needs. There is that middle class that is starting to come up, but it's not coming up at a rate that is helpful enough. And it's with the current situation of the pandemic as well. There's just so much going on. There's a lot of unemployment currently. There's a lot of issues going on out there as well. And then I didn't want to forget one part. I think one of the biggest changes that I've had to deal with moving to the US is that shock from coming to from a place where the majority of the population is Black and people who look like me, and then coming into this place where the majority is obviously white, and the representation of Black people is a lot lower. And it can get really difficult sometimes to even find people who look like you as much as possible. In the community, I've been able to interact with a lot of people who are Black, but in the workplace, as you rightly know, knowing that I'm also in the health IT field, that group starts to shrink as you start to get into these communities or in the corporate world around health IT. So that's kind of my living experience, and is one of the things that I have to balance moving here.
So did your medical license transfer, or medical education transfer to the United States? Can you practice medicine if you want to now in America?
It doesn't translate directly. So I do, with my MBBS degree, that's what we call it, the Bachelor's of Medicine and Surgery. We call it MBBS. It's equivalent to an MD. But for me to be able to practice in the US, I would have to take some licensing exams called the USMLEs. I would have to take those. I would also have to apply to a residency program and go to a residency program before I get the license to be able to practice in the US.
Is there any thought of doing that, or are you going back to Nigeria to bring what you're learning here to your people into that country?
Okay, so that brings two things in one. The first part of it, let me answer that. So coming to the US for the first, when I left Nigeria in 2012, coming here, my plan was to come here, take the lessons that I came for at Duke, which is in the MMCI program, Masters of Management and Clinical Informatics program, take the lessons from there, get some experience working here for maybe a few years or so, and then moving back to Nigeria to go and use that for, the development of the country, and, getting back at that root of the mission that I really set out for in the first place. But life happened, like life sometimes does. I went through a very rough divorce. It's been a bit of a challenge, and it kind of set it did throw some stones in the track in some ways. But coming out of that process and trying to figure out how to continue to be as independent as I can in terms of finances, making sure that I'm able to create opportunities for my daughter. It did play a part in me wanting to stay a lot longer. But I would also say that as much as I enjoy and I appreciate being in this country and being able to contribute, knowing that, the opportunities that has been given to me as an immigrant here, based, again, not just because I was given that on a platter of gold, but because I have worked so hard to be able to prove myself in a lot of spaces, to be able to get here and also get to this position that I am in. I do not take the privilege for granted, but I am also very conscious of what the future of this country looks like, especially based on these conversations that are starting to come up. What is the future of this country going to look like for someone like me? I am a minority in so many ways. That's what I always say, not just by numbers, but just from the interactions that I've had. There's a lot of issues around sexism, racism, being a Muslim in this country as well. It's just so many, being an immigrant too. So I have this multiple spectrum of things to consider when I'm looking at things. Right now, as of today, I should say, my hope is to be able to continue to stay in this country, and to be able to, make use of that opportunity that I'm getting to influence lives. Because now it feels like I am part of here. I consider Durham my home through and through. I consider the United States a second home to me, because I went through one of the most difficult parts of my life here, and the boundaries that being in this country created for me was very helpful in fighting the battle that, my divorce would have turned into. So I appreciate all of that. And so I am driven to want to continue to stay here and impact lives here as best as possible. But without also forgetting that there is Nigeria out there, which I also want to be available to as best as. So I do a lot of volunteering. I do a lot of science book drive and STEM education outreach and things through some collaborations with other folks that are on ground in Nigeria. So I do not forget Nigeria in all of this picture. But right now, again, like I said, as of today, I feel like I want to continue to stay here and be able to, put back into this community, into this nation, a lot of the gifts that I have been given. So, and I'm hoping to exploring that to the fullest as best as possible. It's not out of my scope or out of my work to want to go back into clinical practice, but for right now, I'm still sticking with the informatics and health IT part and analytics that I am doing. Yeah.
Excellent. Well, thank you for that. We're going to talk about the health informatics in a minute, but I want to ask you another question about African and African American.
Oh.
Of course, the history of slavery, and the ties from Africa to here we are today, and something you alluded to earlier about the condition of America. Mm-hmm. So, we had these people come to Africa and, pluck people out of the country and bring them here and turn them into slaves. Mm-hmm. And one of the things that we often hear by supremacist and privileged white people is go back to your country. And I am certain you can trace your heritage back to your great, however many greats you can get to, where I cannot, And so if there was even an interest in going back to Africa, mm-hmm. as a Black person, I wouldn't know what that meant. Where would I go? So there's the Ivory Coast, there's Ghana, there's Nigeria, there's Liberia, there are all these places, but where would I go? And so when you see Black people, and I'm not a fan of the term African American because I don't know what that means. But when you see Black people, American Black people, or Black people in other countries, do you equate them to your sisters and brothers, or do you see Black people differently that have been colonized, enslaved, neglected? How do you see Black Americans and Black, wherever you are in the world other than Africa?
So wherever I am in the world, perhaps to start from the general before getting to the specifics, mm-hmm. I feel like, especially from my experience, just living in Nigeria, having lived in Nigeria, spent some time in the UK, and also living here in the United States, I feel like the very first thing is that I see every human being as my brother, as my sister, and I give them the opportunity to show from their character, from the way that they treat me or even others around me, because I might be in a privileged situation where they get to treat me in a certain way that's a little bit different, mm-hmm. but a lot more, how do they treat people who might not be in as much privilege that I have? How do they treat those people? Would help me place people in either the good light or the bad light, or whatever it is, or determine how I would interact with them. And then specifically go into the Black, again, like you said, I also am not so much of a fan of the African American tag, but we'll go with that because that's what people say currently. So in terms of African Americans, my experience coming here was that I think I saw the opportunity to learn a lot more. Mm-hmm. And it's one of the things that I just don't understand with the way that situation is currently as well. Coming into this country, I realized that I am Black, and I probably, the first thing, before I start talking, the way people would see me is that she's Black and she's probably African American. That's the first thing that'll probably come to anyone's mind when they see me. So I feel this connection with the community of African Americans here, in that way, that before I open my mouth to speak, the impression that anyone has about me is that I am Black. So anything that affects African Americans in this country definitely affects me. Because before I can open my mouth to say who I am, what I do, or people pick up this accent that I have, the first thing that they see is an African American. So whatever it is that I can do to help to make that connection a lot better, to help to fight the cause, to ensure that people, are given equal opportunities and equal rights, and all of that is being achieved, is something that is personal to me as well. But I wouldn't, generalize as well to say, yes, I am African American through and through, because again, it's not a monolith. I always say that the Black race is not a monolith. Like you said, there's Asian, people from Haiti, people from all over the world, like people from Africa, and then of course people who were born here in the US. I think our experiences are a lot different, and that plays a role in how our mindsets work, in how our experiences, it shapes our experiences. It sometimes also shapes how far we are willing to kind of dream or go, it forms that barrier sometimes in the psychological aspects of things. Then going back to slavery, I had this very different, and I became a friend with one of the great poets in the community. I do spoken poetry sometimes when I have the time to. And the piece that I had shared that caught the person's attention was looking at slavery from the African community. So as much as there is that piece of people, being captured against their will, with guns and all of that, being pulled from their families and all of that, there were some people in Africa at the time as well that sort of were willing to let people come in and take advantage of the opportunity, of that piece, even though that's perhaps minimal, because there were a lot of battles fought around those times to ensure that, the whites do not come to take their brothers and sisters away. But there were some stories that I've heard around being sold into slavery, and yeah, people were sold. So it brings up those two parts for me, which is, yes, I think there is an opportunity for us to acknowledge those pieces of history, and also understand that as people from Africa, we also have the opportunity to help to make sure that the goal that the Black Lives Matter movement, that the quest for equality in the US is being reached. It's not a time of blame, apportioning blames and figuring out who did this better or who did not do this, but it's a matter of, we need to be connected in that way, in ensuring that these goals are realized, and whatever part that I am able to play, I'm committed to be able to do that. I hope I answered your question. Is any part of that, I know it was a compound question, so if there's any part of that I haven't answered, please be free to ask a little bit further.
No, I think you hit on some of the points. I mean, I think that, some of the experiences I've had with, and I'm gonna put this in quotes, Africans, is how they see African Americans. Like, how did we let this happen to ourselves? How did this happen? And there's a fear of, a theory of inferiority over Black Americans. I just can't say that word. There's a, like that, if I'm African, I'm better than you because I've not been captured, I've not been enslaved, I've not been tortured. And yet and still, there's this thing where, as you said earlier, when someone sees you before you speak, there's some things that are already associated with you, whether they're fact or not, they're already associated with you. In America, Black people have struggled to find their voice. They've struggled to find their way. And I mean, we have a pretty good middle class, but I think sort of to some degree, there's like Nigeria, where you have the haves and you have nots. We have people in America who don't have clean water. We have people who are living beyond poverty, people who are categorized, because they get government assistance or something like that. All of the things that you can associate with a group of people have been laid upon us. We as women are the angry Black women. We're, sexually promiscuous, all these things that people have laid at our doorstep and said, this is who you are, which I think is in large part why we are where we are in America, why we have Black men and women being killed randomly, because we're not seen as human. We're not seen as real people, And when I asked you the question about going back to Nigeria, like there is a concerted effort to separate the races in America, right? So there's, if you think about it economically, so, they're doing all these attempts to go to space, to colonize space, right? To move and leave some of us behind, when every country is doing a little bit of this, thinking about, space, the next frontier. But
Right.
but even more than that Black people are left behind. And then you have this contention between poor whites and poor Blacks, right? So I don't know how much American history you know, but there were this Black Wall Street, in Tulsa, Oklahoma, in Durham, North Carolina, and jealousy destroys these communities, right? So if Black people make any advances, they're destroyed. So, it's really interesting to me, and I can't wait till I know more about this, because I read about it all the time. Like, my husband and I, we are seriously considering going to Africa. We want to go, and
By
but
all means, at least go to even see. I would say that's really great.
right. But
Yeah.
the point is, like, what is the value of going to a place where you are unwanted or seen as an alien or a foreigner, even though your skin may look like them? And although I am fair skinned, I am still Black. That just means that my relatives were raped and separated, from their families. That's why my skin is this color. It's not like it's because I was born white or born Black, but I was born the product of Africans. And over the time of my family's history, there was a lot of sexual abuse. My father's side of the family, most of them are the color that I am. And it just shows you how much we have been alienated and pulled from our mothers. You said you're a Muslim. I don't identify with any religious background. I am spiritual, but I don't call myself a Christian. I'm not a Baptist. I'm not any of that stuff. I just believe in my relationship with God and the universe, and not religious. So, but I've lost my Muslim heritage. I've lost my native tongue. I've lost everything to this way of life that I have become, and I don't know if you still speak any of your natural languages, but like you have that. I don't have that, so, and there was a push a long time ago for Blacks to learn, Swahili and other languages and things like that. But there was never any education system put in place where that could happen. So, and probably pretty well, in America as a Muslim, there's a lot of assumptions made about Muslims, right? There's a lot laid on top of that. So that was the reason why I asked you the question, because, like, a lot of Africans that I have met in America have seen themselves as better than me, seen themselves as different from me, and even said to me, I allowed myself to be enslaved. I allowed my and it's just really, a sad thing to hear that your own countrymen don't see you as valuable.
I usually don't. I hearing you speak about that experience, it makes me want to just reach out and give you a big warm hug. From this
I'm hugging you now.
From
I'm
this
hugging you
lady
now.
sitting right here, just understand, and please, just know that that is not how majority of us think. That is not how majority of us, perceive African American. One thing is, bad tends to go farther and travel longer, travels more distance. It looms larger over good almost every
All
single
the
time.
time.
So you would always hear those things, and it would stick out a lot because it does have a personal connection, and it gets to one. But I want you to know that at least I hear, and a lot of people that I know do not have that perception about the African American community.
That's very wonderful.
my perspective of the African American, I would say that it went through a revolution phase, which I feel that, and that was the connection I was trying to make earlier on. Moving into this country, I saw an opportunity for me to learn about all of these things you've talked about. So learning about the history of the US, learning about the history specifically of African Americans in the US, I continue to learn about that every single time. I look for the opportunity to go to conferences or sit in spaces where all of these things are discussed. I also look for resources online, in books, anywhere I can find them, to be able to get into all of this. But then I think also in terms of my experiences, I think it's very important for people to go outside of their comfort zone to be able to see African Americans in the light that they are. I am so glad that I lived in Maryland for some time. After studying here, I lived in Maryland for a little bit. I lived in Baltimore specifically. So, there is a different experience that I had living in Baltimore of African Americans than moving here to Durham and, living with African Americans. So I can see that there is a huge spectrum of people. And there is a lot that experiences, especially generational experiences that are a lot more psychological, can play in the way that people come up. I can talk like this, but even in Nigeria, we have our own things as well. There are issues around tribalism, around a whole lot of things that do affect our nature. There is also the family structure, which is a very important part. And I that's one part that I feel and I hope that there is an opportunity to hold on to a little bit more. That family structure of having a male role model in the house, if not in the house, at least someone in the community who is able to hold on to people and be able to make them feel like you're loved, you're wanted, you can do anything. You can just dream. Giving people the opportunity to open their paths and be able to be exposed to different things. I come from a very low socioeconomic status in Nigeria. I lived in Lagos, but I lived in one of the most rural parts of Lagos. So it took me reaching out to people, getting out of my comfort zone to be able to get exposed to different areas and even having that opportunity to feel like I can dream beyond the experiences that I have. And I think that's one piece that is very, very important. It's also one of the reasons why one of the first slides that I always show at all of my STEM events when I'm going to Durham schools or any other places is a transition from where I used to live in Nigeria. Where I used to live in Nigeria was, it's rural of the rural. When you see that picture, it leaves a lasting memory in your head. That to understand the fact that whatever situation you are in currently, even, the way that the country is at this point, there is some level of privilege that you have, the privilege of education alone. Mm-hmm. The privilege of education alone. We can go into details about what the standard of that education looks like. That's, we can talk about that to death. There's always opportunity for improvement and all of that. But the opportunity of education alone is something that a lot of kids in Nigeria do not have access to. And that also is one of the reasons why there is that continued gap between the rich and the poor in terms of opportunities and all of that. So I just want to highlight some of those things. But I feel like just giving kids and giving everyone the opportunity to dream and be able to aspire to whatever places that they want to go to would become very, very important as we move forward. And about you wanting to come or wanting to go visit Africa, please, 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 please go. I can tell you, firsthand that Africans, I don't like generalization, but for the most of the parts, Africans are always warm, kind, accepting people. They are people who we are very enthusiastic about seeing new people, about wanting to interact with people, about wanting to show our culture, to show our hearts, and to show our feelings, or to share our experiences with other folks. So please go. A lot, like I said, majority of people that I know would see you and welcome you with open arms. But that said, too, everywhere we go in the world, there is always the good people and the bad people. So you want to be aware of where you're going to as well. You want to read about it. You want to figure out certain people who will be your guide as you navigate. But for the most part, again, I can say it through and through. we are very open people. We welcome people. One of the shocks I had here is the concept of living in a place where you don't know who your next door neighbor is. It's absolutely, it's not the way of Africans. Africans, look at themselves a lot of times like brothers and sisters. You know who your next door neighbor is. You interact with them. There's opportunity to interact with people who are outside of your family. There's just a lot more open and more warm in that sense. So I hope I was able to answer some of the pieces of the questions.
I appreciate that very much. So let's get to your career in America. So medical informatics and STEM. So something you highlighted earlier, I've been in STEM for 45, 46 years, a long time. And even today, when I go to conferences or I do things, I find myself the only person that looks like me in the room. And being female is even worse because I find myself as being the only Black woman in the room or one of few Black women in the room. Black men are sometimes more, sometimes less, but it is, STEM is one of those fields that has always been thought to be for people who are highly educated. And that can't be Black people. That cannot be Black people. And as you probably know, there have been a lot of faux pas in STEM that have actually harmed Black and brown people, have really been, not advantageous. In healthcare, for example, we have lots of issues there. They say in America, more Black women die in childbirth than they do in some underworld countries. Black men, don't live to, ripe old ages because of healthcare. Most of us are a little bit distrustful of healthcare, because, you go to the doctor and is this doctor got my best interest, or is he trying to make more money for the hospital? Is he trying to make more money for himself? Elective surgeries, all of these things that happen where Black people are sitting there marginalized, whereas traditional family medicine, is one of those things where, depending on where you live, depending on who you know, depending on how much money you have, how good your regular general health, going to get a physical every year, getting a flu shot, all of these things, are these things where we have been struggling to figure out how they would work. So being in healthcare, how do you intend to address that? And I don't mean just you general, but I'm just thinking, hypothetically, how are these issues addressed when for poor communities, healthcare is a challenge?
So I think that is a big question. And like you said, it's very complicated. It has so many perspectives to it. And I think it has so many pieces that it's just important to look at it as a whole, and also break it off into its different points and try to fix that. All of the things you highlighted around the access and on the lack, or should I say the lack of access to care, and the trust in the care system, in the healthcare system as well, are very valid. They're things that I've also, by virtue of doing research in this country, by virtue of being in different roles at different organizations, going from bioscience to pharma to academic medical center, these are front and center in some of the work that I've been fortunate to be able to work on. And it does rubs off on me in a lot of ways as well, because one of the things that people say, one of the key things that has been identified here, sometimes your zip code is a better marker of your health situation or what type of healthcare services you would. It's just ridiculous that in 2020, your zip code would be a limiting factor in what your health would look like. But that's just the reality in the US at this point. And I think that is just so much again, and it aligns again with my personal mission. Either wherever I might be in the world, it's one of the things that the whole issue around access to care is a big deal for me. And so just knowing that in terms of what I hope that I can do, I think that whatever I can contribute, and that's why I'm still not taking that possibility of me practicing medicine. That's one of the reasons why I'm not taking it off the table just yet, because there, if you look around, there is just that shortage of people who look like me in the primary care setting in the US at this time.
Mhm.
And a lot of the issues around the trust that you talk about, it's complicated by that fact, in a lot of ways by that fact alone. When you have people who, and it's not supposed to be that way. And that's the part that really gets to me the most. When we take the Hippocratic oath as physicians, we are supposed to be representatives of every single human being, regardless of what their color is. You can't have a different mindset when a white person comes into your clinic. You have to see them as a human being first and be able to individualize their care as best as possible to meet their need. The whole concept of knowing who your patient is, figuring out what their pain points is. I can give you a very good example. For instance, someone comes in, there was a man who came into my clinic some times ago, and it took me to just, ask them basic questions. It's not all about the medications. It's not all about, just jump into the next therapy, jump into the next diagnosis. It's more about taking a moment to breathe with this person, be in the same, actually occupy this same space that you are in with them. Try to get to know them, understand them, figure out what their pain points are. There's a part in our pediatrics rotation where it's always, don't treat the patient. Don't just treat the patient. Figure out what their concern really is, where the pain point really is, before you can figure out what approach you might be able to take. So the patient I was talking about earlier on, they came in with borderline hypertensive situation. They have, high blood pressure and all of that. And it took me to ask them, just tell me, what does your day look like? And he gave me an account of how he runs his day. And it was obvious that, okay, the problem is not perhaps what you've eaten or like a family history of hypertension or something. It is more about how you are sleeping. Something as, deep as that. Could we modify the way you've structured your day? Can we modify that a little bit to accommodate a little bit more sleep in your time? So instead of meeting people at this time, can you ask to meet them at this other time so you can sleep for a longer period of time? And that simple thing. By the time this man came back to my clinic, the next appointment we had, his blood pressure was fine. And he continued to monitor that. Again, that's very basic and very simplistic in the way to look at it. But it does matter that whenever you have someone in front of you, you try to understand their experiences and be able to know. And coming to the US as well, just when you see a Black person come into the clinic, you can't just treat them like everybody else, because everybody's experience is different. So taking that moment to look into their history and understand, okay, so how are you doing today? What's your history like? Where do you live? And that's why, community healthcare providers would be very, very helpful as well. Not just the ones that we would be able to go see in the clinic, but also people will be able to go into people's homes and figure out what's going on. That would be very, very important in ensuring that equality is brought to the par as best as possible. I think that a lot of physicians, I think it's coming out now with a lot of the conversations around racism and a lot of conversations around races, that a lot of white physicians, and I do not say all white physicians, but some white physicians would see Black people and they would already imagine certain things. Implicit biases are, there's just a lot of them. Whenever if a Black patient comes in to ask for, they have chronic pain and they need painkillers, you feel like their pain is, they have a higher tolerance for pain, so you shouldn't give them a certain amount of pain medication. And so it affects the quality of life of that person. Of course, they won't come to you anymore. Of course, they will try to look in the streets and figure out what else can they be able to use for for their chronic pain. And that, builds on top of it, just that circle of mistrust in the system and, the lack of access to the healthcare system as well. A lot of the ER, there's a lot of metrics around emergency room use. It's a lot more in the Black community because there's that relationship that's supposed to exist between a primary care physician and Blacks, it's just not existent in a lot of situations. I've also had my own fair share of those things. Again, like I tell you, when I go to the clinic, the first thing that they see is this Black person. They don't see me as a physician. They don't see me as an IT director. They don't see me as a Nigerian or someone who, they don't see me as that. They see me first as a Black African. So I have my experiences to tell as well. And I can, it's just what it is. And unfortunately, it is what it is at this point. But in terms of solutions, like we were saying, I think there is just opportunities for that learning. I think there's a resetting of the mindset that needs to happen around care. There is that need for physicians to learn more about the culture of people who don't look like them. You cannot escape, even though the majority of the patients you will see at your clinic would be white for the most part, depending on where you're living or where you're practicing. There would be people who don't look like you would show up at your clinic. And you have to make a mental note of wanting to understand people and be able to treat them according to what their experiences and what their issues really, or what their concerns really are. I think putting that in the forefront of any, physician that's practicing in the US would be very helpful. And putting that or infusing that in one way or the other in the education system for medical students would also be helpful. But there's also a lot, like I said, this is a very big, grand thing where policies would be very important to make sure that, there's access to care on both the federal level, state level, local level. It's going to be an issue with policy. It's going to be an issue with financing healthcare. We all know what's going on with the Affordable Care Act at this point, and there's just so much going on about the uninsured. If you're not insured in this country, it's disaster. It's pretty much disaster waiting to happen. And people, I feel like healthcare should be one of those needs that should be met, regardless of what your job is, what your work is, whatever it is. You should be able to get access to basic care, regardless of where you live or who you are or what you do.
Yeah. We only have about 5 minutes, but I want to ask you one question, and then I'll leave the remainder of the time for you to say whatever you wish to say. So one of the things that is interesting about healthcare is scheduling, especially going to your primary care doctor, right? So what I've heard from a lot of the friends that I have that are doctors is, they've got 15 minutes with a patient and they've got them stacked up. They carve out a lunch hour, but they got them stacked up, right? And the interesting piece about that is, so what you were saying about get to know your patient. You've got 15 minutes to see your patient, 15 minutes to cover everything that patient has to say, 15 minutes. And if you go over that 15 minutes, it means that all the patients behind that person is going to be behind. So you're running over, you're over, you spent too much time or whatever it is. And to me, like law, medicine is subjective, right? So there are a lot of things they can't explain, right? So there are these things that people have, like, so people who grow, skin ticks, or people who have, illnesses that are not in the traditional box of medicine, right? So you got high blood pressure, you got a heart attack, you got cancer, things that fall in that normal box, some things fall out. So in that 15 minutes you have with your doctor, and, unless you're going every week to see your doctor, which is unreasonable, you don't have a chance to get your entire medical life in that 15 minutes. So what should be done about that? I mean, how do we address that? Because I think your point you made was very valid. You get to know your patient, you can kind of figure out what it is. Because as you said, you found out the patient's borderline hypertensive, he's not sleeping well. You had to get to know him in order to diagnose that, right?
Yes. So I just left that out a little bit. It was one of the things that was where I was going to with the policy conversation that I started, but I'm also very aware of the time that we have. So I'm so glad that you brought that up. I think the whole setting of 15 minutes for each and running the healthcare system like a production unit is just, it's ridiculous. And it's responsible for some of the misses that lead to error and a lot of problems in the health outcomes for this country. I feel like that is just, I can't believe that that's the situation where we are in at this point. Being a person who studied the clinical informatics program in the business school, I do understand all of the idea around financing healthcare and the bottom line and the reason why businesses, that's the way it is in the US these days. Healthcare system is a business that has to, have a certain amount of, how do I put it, sustainability by itself in a lot of cases. I understand that as well. But at the end of the day, if we do not give the patients who are the center of the care that we provide, if we do not give them the priority that they deserve, we will certainly just be robbing Peter to pay Paul at the end of the day. We will be causing a lot more problem down the line by not fixing that part of it, which is understanding the patient. So to your question, to your point around having 15 minutes, whenever you have a new patient, and I think some clinics do this, when there is a new patient, you have to give them as much time as is needed to understand who the patient is. So there has to be some ways when you're scheduling the appointment to figure out, has this person been seen by this physician before? Is there a history or a connection between this physician and this patient before, where it has been established that this is what their life looks like? It has to be something that's ingrained in the scheduling system, where you can say, this patient is new, so let's extend the time that is available to them, figure out how to manage the other patients that the physician would have to see that day. There has to be an accommodation for the fact that this is a new patient, that a relationship needs to be established. And like I said, I've experienced that before in some of my appointments, where this is a new, I would take maybe 30 minutes or 45 minutes with the physician. And I think that always helps. So that first meeting, I think there's an opportunity to do that. That first meeting with that particular physician needs to be one that would establish that relationship with them. The subsequent meetings or the subsequent clinic visits can then be this 15 minutes crazy, which I still don't understand. Again, it has to, there's need for, we know the old concept of budgets and buffers. We can do that with finances. We do that with projects. Why are we not doing the same thing with the healthcare as well? So if a patient is coming in, you cannot set the time as 15 minutes and not give a few room for a possibility of some conversations that might come up that might take up more than that. And this, it's a spiral that comes. There's less people are being employed to see patients. There's a huge volume of patients to be seen. There's underemployment in the healthcare system. It's so funny. In the healthcare system, there are fewer physicians that are being employed by this. Even the biggest academic health centers do this. There is a shortage of the number of workers that are actually needed to cater to the volume of patients that you need to see. And then there is that also backlog of the shortage of medical students coming into the program. There's a shortage of people moving from the medical program into the residency. There's it's just a ballooning. But to your point, I think with that scheduling, there's just that need to understand the fact that a relationship needs to be built between a new patient and a new physician that is seeing themselves. And for that first visit, there's always the need to extend that a little bit more to accommodate understanding the patient. Understanding the patient is always crucial to knowing what solution to provide to that patient, and understanding what to do next in those situations.
Well, I think in a lot of cases, they do that for new patients, so they have a new patient day or a new patient time, they do that to some degree. So I think that they're on the track to address that. I want to thank you so much for talking with me today. It has been absolutely enlightening. And I hope maybe later in the year or at the first of the year, we can talk again and you can tell me what decisions you've made, what you've learned, where you're going, what you're doing. And if I can support you in any kind of way, please let me know how I may help.
It's such a pleasure to know you, and thank you so much. When I was at Duke, I remember all of those emails that I get from you. It's just awesome to know that there are people like you in the system who is always looking out for all of those opportunities for us to do better by our in terms of diversity and inclusion, and making sure that we are also paying back to the community in the best of ways. And I think that's how I knew you in the first instance, which is volunteering for different programs across Durham in helping. So thank you for this opportunity, and I will definitely be open to coming up again and discussing what that looks like. I still strongly, and I wanted to end, if you would allow me, maybe just a minute more. I do strongly believe in this country. I do strongly love this country because, like I said, I went through one of the toughest times in my life here, and the protection and the boundaries that this place created for me was very helpful in me being able to overcome that and still be able to, take the leap in my career and all of that. So I am fully vested, and I hope that, we don't all lose hope just yet. I hope that people come out to vote. I hope that people decide to take actions in any possible way. I hope that everyone who lives in the US would take some time to learn about the US, learn about the history of the different diversity that is available in the US as it relates to their community, as it relates to their their corporate world or their career associations and all of that. I hope that they do take a moment to think about the experiences of the person that is sitting across the table from them or sitting next to them in different spaces, and that we continue to be sensitive to each other's experience as we walk across life. I hope we can all work together to make sure that things get better. If we don't work, it is going to fail miserably. And it's just a general, I think it's a general knowledge that whatever you don't tend to, whatever you don't work hard at, whatever you don't put in the work that needs to be put into it, whatever you leave to stray, it always goes astray. It always ends terribly. So I think for the purpose of the well-being of every individual that lives in the US, for the purpose of everyone, we need to all work together to ensure that we create a more equitable system for us to be able to live in harmony. I would say that.
Well, I thank you very much for that. And I would just share with you that, most Black people love America. We don't. For all that's been done to us, we still love America. We still have faith and hope in America. America is constantly reminding us how little we matter to it, but we still fight for this country. And it's wonderful to hear you say the same thing. We, may not be able to put our American flag on the front porch, because, we may not be able to afford a flag or whatever the case may be, but we are as patriotic as anyone else. And it's good to know that people who come to this country find that same value in the country and see how the country has helped. We just have a long way to go. We just have such a long way to go. And it's going to take voices like yours, as you come to terms with your career. I really think you should consider studying and getting that doctorate degree and becoming a medical doctor. Go do your residency, because communities need people who have a sense of who they are, what their value is to the community, and how they can help others. And I do also think, and I hope I'm not preaching, but I also think you should go back to Nigeria, because one of the bad things about what we do is we leave our base, realizing our base is vulnerable. And if we don't go back to where we came from, if we don't go back to our homes, we're taking a talent away from that community that it needs desperately. And maybe you can do both. Maybe you can be a doctor in the United States one year, go to Nigeria the next year, and just keep going back and forth. Whatever it is that, and I hate to say this because we're really running out of time, but when I look at Africa, like there's a television show that comes on called Aerial Africa. It is absolutely gorgeous. I mean, I've never seen anything like it before in my life. I mean, like it's the variety of trees, which is one of the things I try to tell people. Diversity is the universe's argument. It's the universe's foundation. It's the universe's theory, because there's not one single kind of tree, not one single kind of flower, not one single kind of fruit. It's the diversity. And the fact that we can't reconcile that with human beings, like, white supremacy or white privilege, I don't even know what that means, because the university was not made or intended that way. Because if all you saw was pine trees, you know that the universe did not subscribe to diversity. But the universe is so diverse. And Africa, you know, when you look at it, every single thing is in Africa. Gold, silver, I mean, you name it, is in Africa. You know, whether people challenge whether that's the motherland, you know, people challenge whether that's where life began. And I'm not here to, I'm not you know, one of those people. I'm not a physicist, or, you know, one of these people who know anthropology. But I will say this, you know, when you look at what you see in Africa, it is so profound compared to what you see in other parts of the world. And there are beautiful parts of the world. I mean, absolutely beautiful parts of the world. America is one of these places, you know, especially if you come south, all the trees and all the things, you know, not a sidewalk jungle, but really the beauty of the South. You know, the South is absolutely phenomenal. You know, I love to go outside. I'm a tree hugger. So I go outside and hug my trees. I talk to my plants, you know, I'm out there having conversations with how beautiful they are. I think that in a lot of ways, we need people like you to keep doing what you're doing, pursue your career, you know, keep giving to the world, you know, because we are grateful that there is a person like you out there.
And I appreciate your perspective. I appreciate the advice. And like you said, I think the part that I am on, and to let you know, again, like I said, I remain strongly collaborative with people on the ground. I don't have really, my most dear relatives to me, my mother, my sisters, everyone that I know, they're out there in Nigeria. So there is no way that I can totally disconnect myself from that. It's just not possible. And that is why so it's always a balance between where do I need to be able to make the most impact, both where I am and every place that I love in the world. I always consider myself a global citizen. So anywhere that I can have an influence and impact at all, it always matters to me. And you know that, you know, Nigeria is always front and center of that as well for me. But I always, again, balance it up with where do I need to be that would give me the biggest ability to make the most impact. And that is what drives me the most.
Well, thank you so much for chatting with me today. I appreciate that very much. Stay safe and stay in touch. And like I said, if I can assist you in any way, please let me know.
Absolutely. Thank you so much. All right. Do have a great rest of the day.
Do the same. Have a good day tomorrow. I hope you have the day off and you can relax some more.
I do. Thank
Absolutely.
you. All right.
And look for the video shortly.
Will do. Thank you so much. Bye-bye.
Bye.